On Monday, the number of COVID-19 cases continued to exceed recoveries in Malaysia. R0, which measures a disease infectivity, and any number above 1.00 indicates that an outbreak is accelerating in growth. Yesterday, Malaysia recorded an R0 of 1.07, adding pressure to the nation's healthcare system. This means the third wave of the COVID-19 outbreak in Malaysia is far from over, but that hasn't stopped Malaysians from leaving their homes more often than any other time since the movement control order was implemented in March last year. Handphone mobility data shows that as of the end of March, it was only 2% below levels typically seen before the pandemic. The increase came just 2 weeks before Malaysia started seeing a reversal in its gains against the outbreak in recent months. The data was compiled by the Institute of Health Metrics and Evaluation located at the University of Washington in Seattle and is based on anonymized mobility data from Google, Facebook and Apple. These tech giants had gathered anonymous location data from their users and provided it to researchers and policymakers to help their COVID-19 responses. The location data is used as an indirect yardstick for the extent of which social distancing is being practiced, which in turn is a key measurement of preventing the spread of the disease. According to the data, mobility fell as low as 44% below normal levels, following the introduction of the second MCO in some states and territories in January this year, as the pandemic threatened to overwhelm Malaysia's healthcare system. Nevertheless, the rules were gradually relaxed, with one sector of the economy after another granted exemptions to continue operations. Mobility increased to 41% below normal on February 14th and 23% below normal by the end of the month. It continued its rise to just 2% below the normal level as of the latest available data on March 31st, where it was still on the uptrend with no signs of slowing. For comparison, even in the middle of last year, when Malaysia had few COVID-19 cases, mobility was still 7% below pre-pandemic levels or less.